Hello, I'm Lesley Stewart, Director of CRD, the Centre for Reviews and Dissemination at the University of York in the UK. CRD is a research department that specialises in evidence synthesis, and one of the things that we do is to produce PROSPERO, our international prospective register of systematic review protocols, which is why I believe I've been asked to talk about whether registration has succeeded in reducing duplication in systematic reviews. Over the past few years, there has been growing concern about proliferation of systematic reviews addressing the same research questions, and that many reviews have been repeated without reasonable justification. There may, of course, be very good reasons for repeating a review. As described in a paper by Tugwell and colleagues reporting on the development of a checklist to help decide when intended replication might be useful, that describes direct replication as purposeful repetition to verify the findings of an original review, which might be warranted if, for example, there are concerns about conflict of interest. If a systematic review of the effectiveness of a drug has been carried out by the manufacturer, then replication by an independent team may be valuable. Conceptual replication by purposeful broadening or narrowing of the research questions posed in the original review may also be justified. For example, looking at a more focused population that may better reflect the characteristics of the population to which the results of the new review will be applied. On the other hand, duplication, the needless, unwitting or unacknowledged repetition of reviews, is wasteful of resources, most clearly of finite research funding, but also of researcher time, skills and effort. There is an opportunity cost in terms of alternative research forgone, and the resource spent duplicating a review may have been better spent tackling a different research question. Duplication generally does not add useful information to the evidence base, and by the same token, neither does a badly done review, irrespective of whether it is the first or the fifth review on a topic. So for me, at least as important a problem as wasting resource is that duplication can create additional work for evidence users. Policymakers and healthcare providers may need to determine what additional information, if any, new reviews provide, and to make sense of any discrepancies. It can become difficult to see the wood from the trees. As I'm sure you're aware, a key feature of a high-quality systematic review is the development of a protocol that sets out the main objectives, key design features and planned analysis, and which should ensure that the review methods are transparent and reproducible. Adherence to this pre-specified research plan should help avoid bias. Detecting and mitigating bias in included studies is of course central to systematic review methods, yet the same pressures to be selective in conduct, reporting and publication are also likely to apply to systematic reviews themselves. And it seems obvious that changes in emphasis that occur between protocols and completed reviews, such as adding or removing outcomes, has potential to bias review findings. It's therefore important to be able to compare completed reviews with what was planned in their protocols. Whilst not all protocols are publicly accessible, registration records, which provide a summary of the key elements of the systematic review protocol, are available publicly for anyone to look at and enable that comparison. So registration of systematic review protocols can help guard against reporting and other biases by capturing the key elements of a planned review and maintaining a permanent public record of these. Registering reviews prospectively before the review gets underway reduces the opportunity for conscious or subconscious manipulation of, say, eligibility criteria to include only certain studies, or changing outcomes as the review progresses in order to mould results to reach a desired conclusion. When the review is published, it can be linked via a registration number and compared with what was intended at registration and in any subsequent updates to the registration record. Readers, including peer reviewers and journal editors, can then decide for themselves whether any changes or discrepancies are likely to have introduced bias. Providing open access information about ongoing systematic reviews through registration also encourages transparency and resonates with public appetite for openness and disclosure. And coming to the topic for today, prospective registration also has a role to play in avoiding unintended duplication by making in-progress reviews more discoverable, enabling anyone who's considering commissioning or carrying out a review to search the register and check whether there are any reviews already in the pipeline that address their topic of interest. And if they do identify similar reviews, to consider whether their planned review remains justified and decide whether or not to proceed. The registration number may also be useful in onward tracking of review use and impact. So helping avoid unintended duplication is an important but not the only reason for systematic review registration. And these were the motivating factors which, along with the publication of the PRISMA 2009 statement, which encouraged reporting of a registration number if available, led CRD to develop PROSPERO as the first dedicated systematic review register. Developed by CRD with NIHR, that's the National Institute for Health Research in the UK funding, and support from an international advisory group, PROSPERO launched in February 2011. And in the 11 years since its launch, I think it's fair to say that prospective registration of systematic reviews has become accepted as best practice. PROSPERO requires prospective registration, which is increasingly becoming referred to as pre-registration. Reviews should be registered after a protocol has been written, but before screening studies for inclusion starts. The registration record captures key design features, including inclusion and exclusion criteria, outcomes, and search and data synthesis strategies, along with information about the research team, funding, and planned timeline. We also maintain a time-stamped audit trail of any subsequent amendments that are made to the record and issue a registration number which, as I have said, enables the final published review to be linked with and compared to the registration record. Many journals now require inclusion of a registration number in systematic review publications, and some funders, such as the NIHR, require it before funding is released. PROSPERO operates on an open access, no-charge basis. It is free to register a systematic review and free to search the register database. And I think it's important to note that the content of each registration record is the responsibility of the protocol author. PROSPERO does not provide peer review or endorsement of content. Now, when we set PROSPERO up, we anticipated receiving about 2,000 registrations per year. And just how wrong we were. In 2011, there were less than 300 registrations, after which the numbers grew substantially year on year. In 2015, there were almost 5,000, and in 2021, just under 39,000 registrations. The cumulative total as at the end of August this year stood at around 170,000 registration records. And of course, those are only the reviews that are registered in PROSPERO. Some are registered elsewhere and many are not registered at all. In March 2020, PROSPERO made the decision to fast-track registration of review protocols related to COVID-19 and to aim to publish these within 24 hours of submission, Monday to Friday. The intention of fast-tracking was to support the global pandemic research endeavour by making information about planned and ongoing reviews public as quickly as possible, and to provide researchers and policymakers with an overview of the evidence synthesis pipeline. We hope that this would also help reduce unintended duplication by enabling authors to check whether similar reviews already existed before embarking on a new one, and that they could do that based on up-to-date information. Indeed, the PROSPERO homepage encourages those registering reviews to first check whether a suitable review already exists and not to duplicate without good reason. However, it quickly became clear to PROSPERO administrators that there was considerable numbers of very similar reviews being registered. And this sparked a small-scale research project carried out by CRD doctoral research fellows Lucy Beresford and Ruth Walker, which examined the extent and nature of duplication in a sample of PROSPERO registration records related to COVID-19. And this included exploring whether replication was done unknowingly or covertly or explicitly for good reason by protocol authors who were open and transparent about replication. The graph shows the number of reviews on all topics related to COVID-19 registered between March 2020 to January 2021, with a peak of around 600 reviews being registered in April 2020 and then declining to around 200 per month. And that's the rate that has continued since. Resource constraints did not allow examination of all the COVID records. When registering their COVID-related reviews, protocol authors select from a list of 17 topics which are linked to a quick search and filter facility on the PROSPERO website. And 4 of these topic areas were selected for study: epidemiology, transmission, treatment and rehabilitation, and looking at registrations that took place between March 2020 and January 21. Within topic areas, records with similar subject areas, which were identified by coding and matching keywords based on the review title, were compared using the PCOS criteria recorded in the PROSPERO registration record. A judgment was then made about whether PCOS were close enough to be considered duplicates. So, in other words, reviews with differences in PCOS that would be considered as conceptual replication as described by Tugwell were not classed as duplicates, but direct intended replication was captured alongside unknowing or undisclosed repetition. First instances, for obvious reasons, were not considered duplicative and are not included in the numbers. Of the 1,054 records examined across the 4 categories, 138 were identified as having been submitted when at least one similar protocol was already registered in PROSPERO. So across the categories, this accounted for 13% of reviews during the selected periods, but duplication was most pronounced for reviews of treatment, where 20% of reviews were considered duplicative. There were, for example, 14 reviews of hydroxychloroquine with the same or very similar PCOS to an already registered review. There were only 2 examples of rapid reviews being replaced by full systematic reviews, which was quite surprising, as we had anticipated that after an initial rapid review, which may have used abbreviated methods owing to time constraints, may have been followed up later by a full systematic review. 23 systematic reviews and 1 additional living review were registered after a living review on the same topic. For example, after registration of a living review and network meta-analysis on all COVID-19 interventions, 7 further standard systematic reviews were registered on the same topic. And this seems particularly wasteful, as living reviews update regularly to capture and synthesize new research as it emerges, and avoids the need for many systematic reviews assessing the same research question at different points in time. We then looked to see whether any of the 138 duplicate reviews had acknowledged similar pre-existing reviews during the registration process. So prior to PROSPERO registration, authors are asked a series of screening questions, including whether they have searched for and whether they identified any similar reviews. And answers to these questions are held in the PROSPERO system alongside the registration record. So of the 138 reviews deemed to be duplicative, 85 of these did not acknowledge any similar existing reviews. 47 recorded that similar reviews had already been registered, but that their review was sufficiently different to them to go ahead. 5 noted similar reviews and stated that repetition was needed. In the registration records themselves, in other words, the content that can be seen by others, 33 acknowledged similar existing reviews and only 4 recorded a reason for replication within the record, despite being advised during the registration process that the reasons for duplication should be made clear. To further understand the reasons why people duplicated existing reviews, corresponding authors were contacted by email and asked to complete a short, simple questionnaire to provide some additional information. They were asked whether they had searched PROSPERO prior to registration, whether they identified any similar reviews, and where relevant, why they believed their review to be sufficiently different from an existing review to go ahead, or why they believed that replication was needed. And 41 responses from 12 countries were received. Of the 18 survey respondents who had indicated that the review was not similar to existing reviews during the PROSPERO screening process, 8 said that they had searched PROSPERO but did not identify any reviews on the same topic, although Ruth and Lucy clearly had identified such reviews. When asked to provide their search terms, some were so broad, such as single words like COVID-19, that a large number of results would have been returned, and screening would have been daunting and possibly not done. Others had used multiple search terms, and when we repeated their searches, all of them identified the duplicate records related to the review. 10 people said that they had searched PROSPERO and found some reviews on the same topic, but decided that these were not similar to the review, so they reached a different conclusion on similarity to our research team. All of the 21 respondents who, at screening, had recorded that their review was sufficiently different to existing reviews, and the 2 who had recorded that repetition was needed, said that their searches found some or all of the reviews that we had identified as duplicates. But none of them had noted reasons for duplication in their registration record. And one of the reasons that this matters is that knowing the rationale for replication may help evidence users assess which forthcoming review to trust and whether or not to act on the first available review or to wait for one that may have made a good case that it will be more reliable. And that might have been something that was particularly useful during the early months of the pandemic. Peer reviewers and journal editors may also find such information valuable when they're deciding whether to publish a review when they know that a similar one exists. So while replication may be justified, it is important to record the reasons for doing so. This slide shows the reasons given for replicating, including having different PCOS, objectives or planned analysis, differences in the databases searched, poor quality of already registered reviews, a need for updating given the rapidity of emerging studies, there being no systematic reviews completed or published at the time of their registration, and so I guess no guarantee that those reviews would indeed be published. And straightforwardly, that replication was needed to confirm or refute previous review findings. A surprising number of duplicate reviews lacked external funding. 88% of respondents said that they had no specific funding for their review. Given that these are reviews on topics related to COVID-19 that may be slightly different from the general situation, unfunded reviews may have been initiated due to an altruistic desire to do something to help and to contribute to pandemic research. And at least early on, many funders were not set up to make rapid funding decisions. The number of reviews lacking external funding is, however, concerning, as these reviews may have lacked the level of scrutiny afforded by the funding application process, including rigorous peer review, a requirement to demonstrate competence and sufficient expertise and experience in conducting systematic reviews, the need to include topic experts in the team, and indeed due diligence in checking for similar reviews. Although not formally assessed, low quality and lack of clarity in registration records was noted, often making it difficult for Ruth and Lucy, who are experienced systematic reviewers, to assess whether reviews were duplicative. And of course, the same applies to register users, who may find it difficult to determine if an existing review is similar or identical to their proposed new one, and this may therefore lead them to going ahead and contributing to unnecessary duplication. Although it could be argued that it might be reasonable to assume that a poor quality registration record may also indicate the likelihood of a poor quality review, and such that the new review can be justified for that reason. It really should be in everybody's interest to produce a clear and good quality registration record. I also want to mention very briefly some of the findings of a recently published cross-sectional study by MacDonald and colleagues, which investigated the completeness and currency of published systematic reviews of remdesivir and compared this with a living guideline approach. Using information available from Europe PubMed Central in May 2021, they identified 38 different reviews of remdesivir. Only 12 of these cited other systematic reviews, and just 4 provided justifications for why another review was necessary. Only 8 of them were registered in PROSPERO. Both research projects were small scale and related to COVID-19, so they may not be generalisable to other areas, but they were similar in their findings. Considerable duplication was noted. Most of this was unacknowledged, and even when replication was intended, the reasons for this were seldom reported. We might consider whether this matters. At least for the PROSPERO study, many of the duplicate reviews were unfunded, so didn't waste financial resource directly. And without knowing more about any reasoning behind each replication, it's difficult to judge to what extent repetition was justified, or whether the research effort might have been better spent elsewhere. As I've said, there may have been peculiarities associated with the pandemic in play that may not be reflective of usual practice. Certainly, the content of some registration records did make us question how well the researchers involved understood systematic review and how experienced they were in this type of research. The low barriers to doing reviews, in that they can be done without funding, they don't require ethical approval or specialised equipment, and perhaps importantly here, can be done from a home desk. That may have encouraged people without the necessary skills, experience and support to do reviews, and may have contributed to duplication, poor quality and a low signal to noise ratio. So to try to summarise, one of the roles of review registers is to help reduce unintended duplication of reviews, alongside reducing bias and increasing transparency. Returning to the question posed of whether registration has succeeded in reducing duplication, well, we know and have evidence that duplication happens. Reviews which duplicate already registered reviews are registered, and reviews which duplicate already published reviews are published, irrespective of whether they've been registered or not. On the other hand, we know anecdotally that after searching registers, some research teams do switch their efforts rather than duplicate reviews. But we don't really know the extent to which registration has reduced unnecessary duplication and how many potentially redundant reviews have been avoided, as we don't have an easy way to capture information about how many people desist from unnecessarily repeating a review. I think we need to remember that PROSPERO and other registers are tools designed to support the research community engage in best practice. Registers collect and provide information, researchers make choices, and ultimately responsibility for unintended or unjustified duplication rests with the research team. However, we have learned quite a lot over the past years, and I think there are things that registration systems can do to help. And so for this and other reasons, we have recently embarked on a major redevelopment of PROSPERO. So the new version of PROSPERO that's currently under development, in that the system will flag potentially similar reviews rather than relying on the protocol author having to search for them. Providing information about the reasons for replication and the value of a new review will become mandatory. We will also require information about whether the review protocol has been peer reviewed and by whom, along with additional information on funding. We hope that guided completion of registration information and a requirement for sign-off on the registration record content by all protocol authors will improve the clarity and quality of information provided, and thereby be helpful in others assessing whether their new proposed reviews will be duplicative. Improved search functionality should also help research funders identify similar reviews prior to commissioning, and additional guidance and information about avoiding research waste will be embedded in the system. Moving forward, we need to increase awareness of the existence, extent and impact of research waste, and that this also applies to systematic reviews just as much as to other studies. Initial checking for similar reviews should be embedded within good systematic review methods and practice, and explicit consideration given to if, when and why replication is needed. As said before, not all repetition is bad. It may be justified, but as a community we need to be more explicit and transparent about reporting reasoning behind replication. Registration and systematic review registers can play an important role in this, facilitating identification of similar reviews to help avoid unintended duplication, making users think about whether another review is needed, and to explain the rationale for any deliberate replication. Also by steering protocol authors to adopt good methods, given that a poor quality review is just as wasteful of effort and resource as a duplicated one. And so registration of systematic reviews should continue to be encouraged. We also need systems to identify best quality planned, ongoing and completed reviews that are fit for decision making and most closely match evidence user needs. And in future, better linkage between evidence users and evidence producers in prioritising, planning and commissioning systematic reviews. Thank you.